Hare Krishna, Yogesh Prabhuji.
Hare
And
Krishna.
Prana.
Anod Prabhu.
So today we have with us Yogesh Mishra, Dr. Yogesh Mishra Prabhuji. Prabhuji is currently serving in Arjikor Medical College at Pulmonary Medicine, and he also holds the expertise in critical care. Prabhuji, during his student life, also Prabhuji was a brilliant student. Like he is in the top 10 in his college during the MBBS and also holds a top 5 position during his university days. Currently, Prabhuji is also involved in preaching for the last 4 to 5 years. I know Yogesh Prabhuji personally, and we all learn very much. Besides being a great doctor, he is also a very compassionate senior towards juniors like us. So, Prabhuji, despite your busy schedule, thank you for taking our time out for this podcast. Our team Tattvaras is really grateful to you. Thank you.
Thank you for dragging me here. And thank you for having me here, bro.
It's our pleasure. So, Prabhuji, before we talk more about your profession, so who are you outside the white coat?
Who am I outside the white coat? I'm still white, a little bit at my home as well. So, jokes apart, um, I was always a introvert kind of a guy. Somehow you can say that is how my childhood has been. I was always a mama's boy, one can say. I was very attached to my mother. So, and I was very homely. I always like to be at home since my childhood days. And later on, when I, went outside, like college, and I've been outside my home for the last 12 years now. So then somehow our profession demands us to be a little extrovert, to meet with people, interact, to have better communication skills. Still, I would say I lacked in those for the initial year of my professional journey. But later on, as every good turn, I would say, it took in my life after I came in touch with the teachings of ISKCON, and I don't and I'm not shy in admitting so. I do not feel shy to admit that things took a good turn when Krishna came in my life, Bhagavad Gita came in my life, Srila Prabhupada came in my life, my mentor, who's based Ambarish Maharaj, he came in my life. I like to be in temple in association of devotees. I like to travel a lot, and somehow I have traveled a lot after, people say at times that you lose things, right? Or you remove things from your life, you restrict yourself when you come in touch with spirituality. But that has never been the case with me. I've gained so much, so many experiences, a lot of exploration of the world, right? I like to travel, I like to eat. No. At times I like to cook a little bit. So yeah, that's how much I would say.
Okay. So, Prabhuji, what inspired you to become a doctor?
What inspired me? It might feel like a letdown, but it was never an inspiration. As it happens in the middle class families in northern India, I would say Bengal is much more cultured in that way. So we have got only two options, right? Either you take biology and become a doctor, or you take mathematics or become an engineer. The third option is you take commerce and arts and you let your family down so that they can hold down their heads in shape. Or you might go for again UPSC. So to become a doctor, initially it was never an inspiration. I liked biology as a subject. Even before my 10th, I love to read biology books of maybe of a higher standard. So that uh, kind of ignited an interest in biology. And you see, biology as a subject, I never had an idea that biology, just as a pure biology as a subject, can be explored. So we always thought that biology means that you have to become a doctor now. So once I finished my 12th, many of my friends went to Kota. So to join them, I also went to Kota. I was such a foolish guy. I still am. So I went to Kota, and somehow the institute where I joined, Allen, I don't know how the status is nowadays, but back in my time, it was a brilliant place to be. Everywhere you were packed with students. The whole city is about studying, studying, and studying. So then I came into MBBS, and yes, after coming into MBBS, you can say then uh, I started to like the subject medicine as a subject. You grow gradually in your so I didn't like it initially, like or I would say I was not inspired to become a doctor, but then the subject grew onto me. Right? And now you can say I love to be in the white coat as well. Now I like the subject. like to interact with the patients. I love to serve them. Might sound superfluous in today's times, but yes, I love to serve them.
So, Prabhuji, as doctors, you see death on a daily basis, and yeah, and also you see someone get a life from death also. So, my question to you is that do you have any such experience that from there you got a life changing, you experience a life changing moment that uh, like changes your vision or outlook towards life itself? Have you? Yeah.
Uh, Many a times, but what happens with us doctors, uh, that gradually in our profession, after seeing so much of death and suffering, people tend to lose their empathy, right? This is a kind of deconditioning, you might say, happens with most of us. You see a lot of death, you see a lot of suffering on the daily basis, then you think, oh, it's a part of life. And someone, rather than taking a good message from this, or rather taking it in a positive way, or rather having a spiritual perspective towards it, that you see how this world is full of suffering, and this body is full of suffering, it's full of miseries. It's not an object to be enjoyed. Rather, we could become just deconditioned. We close our eyes, we shut down ourselves away from the suffering of the people. And rather than becoming empaths, we become hard-hearted, right? But yes, in my case, definitely have many such experiences. I won't say they are life-changing, but they've had a deep impact on me on many levels. One of the situations was which very much relates to the story of liquid beauty, which Srila Prabhupada many times used to narrate in his lectures. So I remember it was back in 2020 during COVID. So we at times had a few patients with severe respiratory illness, and at that time I was working in the ITU of SSKM hospital. So there once was admitted a girl hardly of age 22, or I would say 23, and externally, yes, one can say that she was beautiful. One can say, and while she was alive, because if you might remember COVID, so initially it was very mild, then it would progress and become severe after 7 or 8 days. Initially, she was doing very fine. So many people would come to meet her, not just her family members. We noticed that young boys, probably of her age only, they also used to come and meet her. As she started to get severe illness, then we had to put her on ventilator. And when we usually put the patient to ventilator, we knock them down, we make them unconscious so that they can bear the pain and the trauma of it. So then I saw gradually the number of people who used to come and meet her on a daily basis decreased. And unfortunately, there came a day when we couldn't save her. She went into shock, and we tried for around 40-45 minutes, but then we just couldn't revive her. And my God, was I surprised when none of those boys turned up. When her dead body was supposed to go down into the mortuary, we called the patient family member. The parents came, but none of those boys came. Because usually after the patient expires, the body is kept for a few hours, 4 or 4.5 hours in the same place. Nobody came to see. Many people came, but none of those boys. So that gave me an understanding that how this body has no worth when one dies. You just take out I would say hardly a 7 or 8 mm thick skin from our body, and you can't then even picture the most beautiful person without their skin, right? You just remove 4 or 5 kgs of an organ from your body, and you can't see the other person with the same lustful eyes maybe you had for them. So then one must then reflect upon the reality of this body, reality of life, and the actual reality of the concept of beauty which prevails in this world. One must ponder. And for this, I don't think one needs to be a doctor. It's very basic. One just needs to be observant. Spirituality does not need a lot, it just needs careful observation. Same goes for medicine, I must say. There's a lot of theory, there's a lot of practical surgery and everything, but every time, since the time we have entered into our college days, from the very first day, our professors would use to teach us that be observant if you want to become a good clinician. A good clinician is a good observer, right? And this idea of being a good observer, it prevails in every sector, if you might notice. If you
Yes.
want to become a good scientist, how have great discoveries come from? They have come from observation. If you want to become a good artist, if you want to become a good comic, now those comics which are now very famous in our country, where do they derive their punchlines from? Day-to-day interaction with the maybe see in streets or in their homes. So in every sector, in every aspect, if you want to become an expert, you just need to be a good observer. One needs to be silent, right? Look and then reflect inwards, and it will give you a lot of perspective.
It feels like you go on, say, and I just hear, there. Like it's so nourishing, nectarian. In Bhagavad Gita, Sri Krishna tells Arjuna that he is the one that does things, and Arjuna is just the instrument. So many people say that doctor saves lives. So are doctors saving lives or Krishna is saving lives? How do you see that?
So coincidentally, we had a discussion, like I had a discussion with some of my very young juniors, who were like first year, second year. Today itself at 6 p.m. we were having this discussion, healing beyond the scalpel, right? And I went through asking each one of them that, you see, if you have got a wound, what are the exact steps in which a wound heals? And then they were elaborating. They were juniors, so they were some faltering, but still they told that first the blood clots, then some cells come, they fight the inflammation, they fight the infection if there's some infection, and then some proteins are deposited, then there's formation of granulation tissue, then fibrosis happens, and then there's scar formation, and after some time the scar is removed and you get a fresh new skin over that wound. So all of them combined, in a combined fashion, they answered this question. Then I went to each one of them and then I asked them, does the doctor go and create that blood clot? I said no. And did the doctor go and ask the blood cells in the body of that person that you go there and fight the infection? Did the doctor go and create that granulation tissue in that wound? Did the doctor go and create the mechanism which formed the scar on that wound? Does the doctor go and create the new skin over the wound? Then what does the doctor do? Right? I didn't want to, kill their enthusiasm, but yes, we have our role. We help in the healing process. We treat, but we can never cure. Even if for an atheist, even if you're having a discussion with an atheist whom by any means you can't get to the understanding that God exists, even for that person, at least you can make him understand just by using simple biology that it is not the doctor who cures. Actually, we give a support, and it is the body which cures everything. Even for the most severe infections, what do? We are giving antibiotics, right? Or we are giving some stimulation therapy to the immune system, and then the immune system does the work. It is not possible that a person has got an infection and you bombard him with the best antibiotics, you fill him through with antibiotics, and he can survive if he has got no immunity of his own. It can never happen, right? So we definitely give the support. That is how God has empowered us with that knowledge and with that skill. So yes, we are empowered in that fashion, with very humbly, with folded hands. I would definitely admit that God has given me that skill. Krishna has empowered us. But yes, we don't cure. We definitely treat. We help in the healing process. So we are a supporting actor, or you can say a background artist. The main actor is, the Krishna himself, God, and the mechanisms made by God in our body is something which cures the person.
Okay. Prabhuji, in your career, have you faced any case or any situation where you have seen that the medical treatment has failed for the patient, but he or she has still survived just through faith in God?
Okay. So again, one might say that I am extrapolating, but today itself, I got a patient. I can't take his name for confidentiality purposes. So he's a 72-year-old man. Not sure about how faithful he is or how much of a belief he has on God, but at least I can see he's quite religious. And he definitely credits God for his health. So this patient, he's coming to me since October of last year. And by November, he came with a lot of fluid in his lungs. So we got that fluid out, tested it for a few basic investigation, but we couldn't get anything. So somehow I repeated the fluid, like many times we do that, and there were traces of cancer, lung cancer in the fluid. So then we immediately sent the patient for a whole body PET-CT scan, which can detect cancer even in the smallest parts of the body. What is the source of that? And then that PET-CT showed that he was having stage 4 metastatic lung cancer, to which usually the prognosis is very bad and we give the patient a few months to live. So that was October of 2025. So even the chances of survival were very low. As doctors, we have to recommend chemotherapy or palliative measures which can benefit the patient. Even if there's 1% chance, one must take it. That is the principle on which we work usually. So I recommended the chemotherapy, I explained him everything, I referred him to the respective departments and all. But that person, he was a bit fearful regarding the procedures, how he would respond and how the chemo would take the toll on his body. So he said that he won't go for the treatment. He will rather sit at home and live the rest of his remaining time with his family and rely on whatever God wants to do with him. That was his line, which I remember. Now today is 18th of March. He was again in the midst of these 5 months. I would say he came to me 3 or 4 times to just pay me a visit. Again, he came today, right? I was surprised. No, as per my calculations, or as per the calculations of what we have read in science, he should not have survived till now. But somehow he was there, and I could see God's hand in that. And today, somehow, he was accompanied by one of his daughters and son-in-law, and they had inspired him, somehow counseled him that he should go for the therapy. And today he was asking me, Sir, aapni bolo, like you tell me whether I will be able to take it or not. So again, I told him that yes, you should at least go for the procedure, and then we sent him, and he's ready to take the chemotherapy now. Now again, Krishna will decide whether he'll survive or not. But at least there are many cases like this. I have seen maybe very few because of my limited experience, but there are many documented cases full on internet where people have survived major illnesses which has no medical explanation. No medical explanation at all.
Okay, okay. Beyond diagnosis and treatment, what should be the ideal responsibilities of a doctor?
I would say the first responsibility is to be empathetic towards the patient. The person would never come and pay you money to tell you their problems, right? But that is exactly what the patient does. Patient comes to the doctor, strips his clothes to show even the most, you can say, hidden and private parts of their body out of confidentiality because they have such faith on the doctors, right? So they come with the mood of seeking help. Again, things have changed, the patients have changed, doctors have changed, the relationship has changed, many things have changed, but still, why shouldn't we discuss what is ideal, right? So the first of all, the doctor should be empathetic. He should understand, stepping into the shoes of the patient, he should understand. Because he is the more educated, at least in that field, more experienced person in that field, he has to take the bigger step and become more empathetic rather than thinking, why isn't the patient, giving me or paying me respect? So the first thing is to be empathetic. That is the responsibility of the doctor. Second, yes, beyond diagnosis and treatment, counseling is very important. Many times we see actually all of the majority of the diseases which prevail in the population today are lifestyle diseases, starting from diabetes, hypertension, obesity, obstructive sleep apnea, or this even cancers, many cancers. All of these are lifestyle diseases. And other than pollution is definitely a major factor. It is the people's own bad habits which lead to these diseases. So we have to counsel them on this. It's not that the patient is smoking, okay, let him smoke because till the time he smoke, he'll continue to come to me for medication. No, that shouldn't be the attitude. And unfortunately, it is somehow in today's scenario, we see people like that. We see doctors like this as well. So counseling has to be a important part of our job. So empathy and counseling, this will do the job. You don't need to become a magician, a wizard. This will only do. You don't even need to become a preacher when you are, a doctor. You counsel them, you treat them, and once the patient, becomes better, has confidence in you, then go ahead. If he has that much confidence, then definitely the responsibility of this is again only this matters for doctors who are devotees or they have an interest in Krishna consciousness. So they should inspire the patients because as doctors, it's a noble profession. We have earned a certain respect and position in the society. We have got a little bit influence, right? So why not share something good? You see on Instagram, these so many influencers are there who are sharing what all kind of nonsense is there on Instagram and YouTube. So they are sharing so much of nonsense and filth in the society. So why can't doctors go ahead, take a step, remove their shyness and share some positive things, some spiritual things with their patient? Why not?
what habits, it can be emotional, spiritual, anything that you think a doctor should develop, a young doctor should develop, that would help him or her in their care, also the patients that will visit them.
Okay. At least we shouldn't do those things which we prohibit our patients to do. Right? At least those habits. Intoxication is a big no. Any form of intoxication, right? Second thing is to maintain a disciplined lifestyle. And to do great in any subject or any field, you need to be disciplined. You take example, you can take example of a a chef to big entrepreneurs like Elon. So, and there's discipline in their lifestyle. This can be taught to the patients as well. I'll give you a very basic example. So, I got a patient. She was 18 years old, and her mother was accompanying her. She came to me and she told that my daughter is having shortness of breath. So she was looking quite healthy. So usually in young ages, we get asthma as a very common disease. So I took a detailed history and nothing was suggestive of asthma. But still the mother was very persistent that she was having, very frequently these episodes of respiratory distress. So then I went into details that, does she have more problem while taking the breath or, holding it or while exhaling? When is it more common, during morning or during evening or or whether it increases with dust or some smoke when she inhales those? So gradually and gradually, her mother started to reveal. And beside that, her daughter was continuously pinching her mother not to share all of that. And then the mother told me that she has those episodes of respiratory distress whenever I snatch away her phone. And and while more, when I prodded more, she told me that she has a habit of playing games. Now it's not as common in girls as it in boys, but she has a habit of playing games and she has been doing it for last 1 year. She plays games throughout the night. And when now her mother has become very, persistent in removing that habit, she snatches away the phone. And as soon as she snatches away the phone, girl starts to have panic attacks. That can be functional, that can be organic, whatever it is. But this has led to a kind of a psychiatric illness, right? So disciplined lifestyle is very important, and a big no to intoxication.
Okay. So, Roji, can you share an experience with a patient that you think you have learned the most from that phase?
Okay. So I remember, like many people say, when they are questioning spirituality, it's actually they are questioning their own life choices. So they say that why do good things happen to bad people and bad things happen to good people, right? So it is always a problem, or it is always the attitude which matters. And again, this is a very common line which you'll find on Instagram and Facebook and YouTube. All of those motivational speakers are speaking this, telling this. But I remember a story which happened with me back in 2024. So it was a night shift. I was in the emergency, and it was the month of February. So just the very next month, you had the board exams, 10th board exams. So I remember the story of two patients, like two girls. So one of this girl, she came with her mother. Her mother was ill. She was having pancreatitis. It's a very, I would say, annoying disease where you have a lot of pain. You can't just stay without painkillers. So she came with her mother. Her mother was very ill. Her mother was separated from her father. So her mother was, for this girl, her mother was her only, residence, only shelter. And tomorrow, this girl was having exams. So she got her mother to the hospital. We started the treatment. She needed to be admitted. And while all these procedures were going on, this girl very silently came to me and asked me, "Sir, I have one request. Can I just sit here and read for some time, study for some time?" I said, "Why? I have my exams tomorrow." I said, "Yes, by all means, please go ahead." So she took out her, I think it was science book or something like that. She took out the book and started to read over there. Only 30 minutes had passed, and then again one girl came. She had a minor cut on her leg, but that required stitches. But it was a very minor cut. So we got her on the bed. We didn't need admission. So we only put 2 stitches. That were the local anesthesia, so it didn't pain a lot. So we finished the stitches and that was it. But the stitches were at such a place that she couldn't wear shoes the very next day or for the next few days. And many people were accompanying her. Her brother was there, her parents were there. They were a Marwadi family. So her Tayaji, Tauji, Taiji, everybody was there. It was like a big celebration. And this girl, somehow she was, you know, she started to cry that, and it was a very silly thing. She started to cry that I won't be able to wear my shoes. I don't have a fresh pair of sandals to wear to my exams tomorrow. No, this was her problem. Here we have one girl whose only family member is admitted with difficult to treat disease, or I would say critical disease in the hospital, and she wants to study. And here we have got another person who has maybe all the avenues, has all the facilities, has all the support which one can have. And for her, the concern was what will she, she doesn't have a new fresh pair of footwear which will she'll wear to the exams. Right? So, you know, if you see, the difficulty was much more in the first case. But her attitude, but even in those difficult times, she knew where to focus. She knew that my job is to get my patient admitted. Beyond that, it is the job of the doctors. I can't go and start the treatment. Even if I take the anxiety, I won't be able to do much about it. So let me rather study. And there's the other girl who doesn't have, apparently nothing was wrong with her, but she engrossed himself into such a artificial problem. And so it is always the attitude which matters. Problems are always relative. They are always relative. Problems, only four absolute problems that we have is birth, old age, disease, and death. Rest everything is relative.
Okay. So my last question will be, so this video may be watched by many aspirants of the NEET exam. So any message for them, Prabhuji?
So I won't give any technical answers because things are changing in competitive exams every year. For NEET UG and NEET PG, both things are changing every day, every month, every year. I won't giving technical answers, how to prepare, which books to read. There's enough information and videos regarding that on the internet. What I would tell those aspirants that first, time is money, right? Hard work always pays off. Third is, do your best, leave the rest on destiny, or if you believe in Krishna, leave the rest on Krishna. And fourth is, even if you don't make it, life has not ended for you. Life will go on. It is just a chapter, it's just a book that you didn't open. There's another big book maybe waiting for you to open and read and explain. So things are not ending. That's it. Nothing much.
You speak so nicely, Prabhuji. I like to go on with the podcast, but we have to end this now. So thank you, Prabhuji. Thank you for such nectarian
Hearing my
bhakti service. Thank you, Prabhuji. Very much. Thank you.
great what you guys are doing. I would say it's a thankless job. It's a very humble approach, and humility is a rare jewel in today's world. So all the best. I have my prayers with all of you. Peace
Thank you.
and endeavor. Hare Krishna.
Hare Krishna.